personal hygiene, specifically bathing, is important for patients just like it's important for you and me. Hi, I'm Kathy Getrist. I'm a nursing instructor in community health. This videotape deals with your responsibility as a caregiver with patient bathing. A bath with warm water and mild soap removes dirt and sweat, called perspiration, increases blood circulation, provides mild exercise, and promotes an opportunity for close observation of patient skin. You will be frequently assigned to bathe patients. You as the caregiver will be able to see firsthand how a patient's condition is changing in any way. The bathing procedure provides an excellent opportunity to communicate with the patients and to observe the condition of their skin. Examples of skin observations that you might make could be discoloration, rashes, sores, dryness, swelling of the ankles or other joints, and incontinence of urine or feces. Remember, always report any change in the patient condition to the nurse assigned to work with you. The patient's condition will determine the type of bath that they're able to take. Some may be allowed to take a tub bath or shower, while others will be needing to take a bath in bed. There are two main types of bed baths, a complete and a partial bed bath. A complete bed bath, as the name implies, means washing the patient's entire body. This is usually done when the patient is perspiring heavily, has incontinence of urine, fecal or other material, or just needs the stimulation that a complete bed bath can provide. A partial bath is another type of bath that you will be assisting patients with. A partial bath might be given in bed, or it might be with the patient seated in a chair or in the bathroom. There are two separate meanings to the term partial bath. Some facilities use the term partial bath to mean when the patient is giving part of the bath and you, the caregiver, is giving the other part of the bath. Usually it's those hard-to-reach areas such as the feet or back that your assistance is needed. In this use of the term partial bath, the patient's body is being washed in its entirety. Another meaning of partial bath is when only certain parts of the body are being washed. This meaning of partial bath will be the focus of today's discussion. Some skin doctors, called dermatologists, suggest that our Western culture is obsessed with cleanliness and feel that bathing the entire body is not always necessary or even warranted. Washing too frequently and washing with strong antibacterial soaps can increase skin dryness and also remove microbacterial organisms that are natural and helpful on our skin. When given, a partial bath should include skin surfaces that touch each other. An example might be under the breast area and chest. Also, areas likely to harbor odors. Examples that come to mind might be the axilla or armpit area and the genitals and buttock. Another partial bath area that should be cleaned is areas that have frequent soil. And things that come to mind would be the hands. The usual body parts that are included in a partial bath are the face, hands, armpit or axilla, under the female breast, the perineal area, and the buttocks. The nurse will tell you the type of bath that your assigned patient should have. Whichever type of bath it is, remember that your patient should always be encouraged to participate in their care as much as possible. Patients receiving specific and special treatments also need bathing. Items that come to mind would be those patients that are receiving intravenous or IV treatments, patients that have drainage tubes, or ones that might be receiving oxygen. These patients, however, will need to have a little bit of special care. Be careful as you bathe the patient and move them that you do not put stress on the tubes, that you never lower the IV bag below the level where the tubing is inserted into the body, and never raise the drainage tubes above the drainage insertion site. You will now see a demonstration of a caregiver assisting a patient to take a shower in a bathtub, assisting with a shower utilizing a shower chair, and assisting with a partial bed bath. Another videotape will give a demonstration of a complete bed bath. Now please watch as these are demonstrated. To assist with a tub bath or shower, you must first gather the necessary equipment prior to assisting the patient into the tub and place these items on a shelf nearby. Place a non-skid mat on the floor, as well as one inside the tub. Place a shower chair in the tub if the patient is unsteady. The chair should be 17 to 20 inches above the floor. Close the door to the bathroom to prevent drafts, and be sure that the room is a comfortable temperature. Explain to the patient what you are going to do. Assist the patient to disrobe and help into the tub, making sure he holds on to the grab bars. Make certain he is seated safely in the chair. Close the shower curtain so the patient can finish undressing. Turn on the water and adjust the temperature 105 to 110 degrees before turning on the shower spray. Assist the patient as needed. For safety's sake, stay with him at all times during the bath and shower procedure. Help dry and provide him with a towel for privacy. Assist the patient out of the tub, holding on to the grab bars. And help him dress as needed. After helping him return to his room, return and clean the tub with a disinfectant. Follow the manufacturer's direction for proper use.
And this is a shower chair. As you can see, it's lightweight, it's plastic, it has a mesh back, it's all waterproof, it's on wheels. This one has a footrest to put the person's feet on so they're not dangly there. It can be put out of the way while we're transferring somebody into the chair. These shower chairs do have brakes, although in my experience the brakes don't work very well, so I like to put them up against a wall while you're transferring somebody into or out of them so that the chairs don't roll away from you. So today we're going to assist Mrs. Johnson into the shower chair here. You notice that Mrs. Johnson has her slippers on. They're non-skid slippers. We're going to leave those on her until she gets into the shower chair so that we don't have to have her feet against the bare tiles so that they don't get cold and so that she still has her non-skid soles on. First, we're going to assist her getting her robe off. And then next I'm going to put the gait belt on. And you notice I'm putting the gait belt on over her nightgown. Don't want the gait belt on against the bare skin, because that might harm her skin. Okay, now I'm going to ask Mrs. Johnson, lean forward a little bit here, and then on the count of 3, I'm going to help you to stand up. 1, 2, 3. Now if she has panties or slacks on, you may need to assist her in getting those off now. If she has trouble standing, you may need to get an assistant to help you pull down the pants. We're going to transfer her into the chair here. Okay, now at this point we can take your gait belt off. You doing okay? Mm-hmm. And then I'm going to stand in front of the chair and hold on to both sides as I roll her into the shower area. Okay, just going to scoot up against the back of the shower wall here. Okay, and I'm going to back this up against the wall here. Okay, and you notice that I've gathered my supplies ahead of time. I have my towels and washcloth, and the shampoo soap is on the wall here. I have gloves available when I need those. Then I'm going to adjust the water temperature here. Taking a minute to warm up. Okay, how does that feel? That feels fine. Okay. This one has a nice little shut-off valve here so that you can just shut it off here. Okay, at this point I'm going to go ahead and take her nightgown off. Okay, and we're going to start by shampooing your hair. So you want to hold this over your eyes here. So we don't want to get any soap in your eyes. Okay, I'm going to get your hair wet. How's that feel?
That feels fine.
Okay, I'm going to go ahead and rinse this off. Is that warm enough for you?
Mm-hmm. The temperature is fine.
Okay, good. Okay, there we go. Here, now I'm going to get this wet. Now why don't you go ahead and wash your face off here. let the resident help as much as possible if they're able. Okay, we're going to go ahead and rinse her off now. Okay, here, I'll get a little bit of soap on the washcloth for you here. Okay, why don't you go ahead and wash a little bit, and I'll get a washcloth too. Why don't you hold on to that and you can kind of rinse yourself off. We're going to make sure we get real good under your arms. Okay, and I'll get under your breasts here. Okay, why don't you lean forward just a little bit and I'll wash your back. Good. Okay, let me rinse off your back for you. Okay, you can hold the water. Okay, I'm going to help you wash your legs and your feet now. Okay, when washing the feet, make sure you get in between the toes very well. Inspect the area. If there's any need for nail care or any problems with the feet, make sure you report it to the nurse. There's a little red area here we may want to report to the nurse. Okay, let's rinse your legs off. While she's rinsing her legs off, I'm going to get my gloves on so that I can assist her with peri-care. Make sure you rinse your feet off real well. Get all the soap out from between your toes. Okay, now I'm going to take a fresh washcloth and assist her with peri-care. Now if she can do the front part of the peri-care, we can ask her to do that for herself. Okay, and you can see you can get the hose down in here very well, and she's going to take care of that part herself. And I'm going to put the hose under here, rinse her off very well, wash her bottom. And I can get under here, I can see what's going on, I can inspect the area. Get her rinsed off real good. Okay, you feel like you're pretty clean?
Mm-hmm, I do. Thank you.
Okay. Water off here. Take my gloves off. Okay, let's get you covered up right away. Okay, now we're going to take you out of the shower area here so I can come over here and get you dried off and get you dressed.
Prior to starting a bed bath on a patient, it's important that the caregiver wash their hands thoroughly before coming to the bedside. Once the hands have been washed, it's important that the patient is told what is going to be happening, an explanation is given to them, and that privacy is provided. Privacy can be provided by pulling the curtain all the way around the patient. Because of the demonstration that we're doing today, that won't be possible, but in reality, you would want to be certain that it was total privacy prior to starting the bath. Then you will want to obtain all of the items necessary for giving the bath and place them on the overbed table. The items that you will want to have would be the basin for the water, the soap, some washcloths, usually 2 or 3 would be good, bath towels, several again would be important to have. You're going to want some lotion that you can use on the dry skin at a later point, nail clipper, and orange stick for cleaning the fingernails and toenails. Then a bath blanket for warmth, as well as a clean gown. The other item that you'll want to have is a laundry hamper or a linen container for the soiled linen after it's removed from the bed. It's important to have the bed at a comfortable working height for you, the caregiver. Once that has been achieved for good body mechanics, then the side rail can be lowered, but lowered only on the side of which you are working. Then you'll want to be taking the top bedspread off, loosening it at the foot, folding it inside itself, making certain that you're not airing these soiled linens, holding it away from your body, and then it can be placed into the laundry hamper. Once that's been done, then the bath blanket can be placed on top of your patient. This is going to help provide privacy, and it also is important for warmth. Many times, even though the room might be comfortably warm for you, it is cool once the patient has water on them and their skin becomes damp. Once the bath blanket has been applied, then the top sheet can be removed underneath the bath blanket. Sometimes patients are able to hold on to the bath blanket to assist in this. In our instance, the mannequin's not able to do that, so we're doing it completely by ourselves. Once the bath blanket has been applied, then the side rail can go up, and it is not until this point that we obtain the water, and that's because we want to make certain that it's as warm as possible when the bath is started. So now the caregiver will go and get their water. The caregiver is back with the water in the basin, and the water should be approximately 105 degrees. Now the side rail can be lowered, and the patient's gown is removed. The patient's gown is loosened in the back. Sometimes they have straps, sometimes they'll have snaps. But you notice that the caregiver is being very careful to remove the gown, but yet not removing the bath blanket so that there's a loss of privacy and warmth. So working underneath the bath blanket, the gown is removed, and since it's soiled, it will be placed in the laundry hamper since a new one will be applied. Now that that's been done, I want to talk a minute about washing with the washcloth for a bath. It works best if a mitt is made, and a mitt is a way to prevent water from dripping on the patient and on the patient's linen, and it also is a way of controlling the washcloth. The caregiver has done it once, and I'd like her to slow it down now and show it in a little bit exaggerated slow motion. You notice that she's wrung it out of excessive water, and then she takes the washcloth and wraps it entirely around her hand, and then takes the other end, tucks it in at the palm level, and you notice there is not a lot of excessive water, and she has control of it, and it stays on her hand. Now that that has been placed on her hand, she will take her other hand and pick up her towel and put it across the patient's chest so it's available when she wants to dry the face. Always start with the face, and the portion of the face that gets washed first always are the eyes. And you would use a separate portion of the washcloth, and starting from the inside, called the inner canthus, and working outward on the eyes are cleaned and make certain that any incrustation is removed, and then the rest of the face can be washed. Most people do not have soap used on the face, certainly not on the eyes. Sometimes they will ask, and you could ask the person if they would like to have soap used on the rest of their face, but remember never to use soap on the eyes. Then the rest of the face, the neck, and the ears get washed. Be certain that you don't get any the washcloth too far into the ears, and then rinse and dry your face, neck, and ears. It's time to move on to the hands. The far hand is washed first by placing it in a basin of water. It allows the nails to become softened so that in addition to washing the hand and carefully getting between the fingers, the hand can also be cleaned by utilizing a nail clipper or what is called an orange stick. And by having the hand soak a little bit in the water, it softens up the soil that might be underneath the nail. After you notice that the hand has been placed in the basin, which has been placed on the toweling, it allows the hand to be washed and dried without getting excess water on the linens. You would then move to the opposite hand. Once this has been completed, important to note dryness of skin and applying lotion as necessary. It'll be an individual call whether or not lotion needs to be applied at this point or not. Communication with your patient during this procedure allows you to know what is needed by the patient or desired by the patient, and also allows for you to have some good communication. The other hand is almost finished being washed and will be dried in the same fashion as it was on the other side. When this is completed, the towel will be placed on the patient's chest and arm area. The upper arms or shoulder area will allow privacy to not only wash under the female breast, but will allow an opportunity to wash under the axilla. If you remember, axilla is the other term for armpit. Because this is an area that harbors quite a lot of odor and bacteria, it's important to wash thoroughly. Also, you notice that she is observing the chest and the breast area, even though she's providing privacy as she does the washing. One of the main considerations with washing underneath the breast is to observe for any redness that may be occurring. A lot of times when there's one skin surface that's rubbing against another, it is a perfect opportunity for a reddened and inflammatory process to start. And if anything like that is something that you observe, you would certainly want to be letting the nurse know about it. Sometimes deodorant or baby powder gets applied and sometimes not. It's an individual decision that you and the patient can make. The perineal area on the female is considered to be the labia and vulva. And again, you only expose that portion that is necessary. Notice as we're zooming in a little bit more closely, the caregiver has washed on the far side, and then she's washing at a different portion of her washcloth on the right side, or the near side. And now the last or third wipe is down the center, called the vulval area. And she's only going from top to bottom or from front to back. You never then go from back to front. Let's see it in slow motion this time as she rinses. The far side from top to bottom on the labia on the far side. Then she uses a separate portion of her washcloth and wipes from top to bottom on the right side, or closer side to her. Then another portion of the washcloth, and she separates the labia and washes right down the center of it. A little bit difficult to see on the video, but you can tell as I've described it as well. Then it's patted dry, and we're going to cut away now and cover the person up, and then I'm going to show a demonstration of how you would do this if this were a male patient. As with washing the perineal area of the female, for the male peri area, you're going to put the gloves on, have your fresh water, and make your mitt. And then you're going to gently raise the shaft of the penis with one hand. And if the patient is circumcised, retract the foreskin carefully to expose what's called the glans penis. Using circular motion then, cleanse from the tip of the penis outward and wash downward towards the shaft with soap and water. And you notice she's using different portions of the washcloth as she does that. Then cover the genital area up while the water is rinsed, and then again you repeating those same steps, circular motion starting from the tip of the penis and washing down the shaft of the penis at the end. Inspection during that whole time is very important to make sure that there are no abnormalities that might be observed. After the penis has been washed, then the foreskin gets returned back to its original normal position after it has been retracted. Then after the penis itself has been washed, the scrotal area gets washed secondly. And lift the scrotal area, wash thoroughly, followed by rinsing, and then patting the area dry. You may be able to notice that there is a underpad in this bed. Maybe it isn't as clear to you, but it's a good idea because it will help prevent any moisture from getting onto the linens themselves. A continuation of pericare for both the male patient and the female is the washing of the buttock area. You notice that the cheek of the buttock is washed first and then followed by washing from the crack up on the patient. This washing of the buttock is the last part of doing a partial bed bath. And it's important always to wash from clean to dirty and removing any fecal material that might be there on the patient's bottom, because it can cause irritation if it's left on the body in addition to odors. So be certain that plenty of soap and rinsed well with water and dried occur with washing of the buttock. Now, the very last thing will be doing the back rub. Back rubs are given with every bath, and its lotion is always warmed in the hand. In addition, sometimes the entire lotion bottle will be placed into the basin itself to be warmed. And after it's warmed in the hands, the hands are applied to the low back and work in symmetry going up the back and around the shoulders and down and back up again around the shoulders, and providing firm, smooth strokes. This should not be a choppy experience. It should be really relaxing for the patient. Most of the times when done well, the patients very much enjoy a back rub as part of their bath. It is not something that you should be asking the patient, would you like a back rub? It should be assumed that a back rub would be given with every bed bath that's done, and this is certainly because the patient is spending an awful lot of time in bed, and those muscles and bones will get very achy. Sometimes patients feel that because you are so busy, no, it's okay, it's not necessary to give a back rub, so don't give them the option, just go ahead and do it. A back rub should last approximately 1.5 to 3 minutes. And you wouldn't want to just give a back rub for 30 seconds. It's not a very relaxing procedure when it's only done for such a limited amount of time. This is another reason why it's so important to have short nails. To be giving a person a back rub can easily scratch a person if the nails are long. So having short nails for this part of the bath is particularly important. Now, if there's any excess lotion on the back after the back rub has been given, just blot it dry with the towel that you're using for drying.